21st, 2025, and it's 11:30. It's 11:30, and we're here to discuss the jail medical resignation notice.
Yep. So, yeah, we're just here to discuss the jail medical provider. He was under contract with us for the last 20 years. And he called me last week. He's submitting his 60-day. He's given us a 60-day notice that he'll be resigning from doing that. We're currently paying him $20,000 a year to do those services, to come into the jail 1 day per week, and to take phone calls and text message with medical questions from the jail staff. So we're going to have to start looking for an alternative. His contract only binds him to 30-day notice. I talked him into 60 days.
Okay.
So I'm anticipating we'll get the letter from him this week. He's drafting it.
Okay.
Now. And
they just have to be either a doctor or a physician's assistant?
Yeah, you could.
Nurse practitioner? You
could potentially have a nurse practitioner. So we're looking at a few options. We're going to try to reach out locally. Mm-hmm. There's potentially some local doctors that may be interested. I don't know what they'll want to charge, though. Okay. So we'll have to reach out locally and see first. And we're also exploring the option of telehealth mixed with it. But as of right now, we don't know what that cost is going to be. This meeting is more just to inform you what's going on and tell you what we'll be working at, and when we get some more information about if there is any interest in it. But we'll probably be putting out some notice to some of the doctors around to see if any of them are interested in doing it in some of the clinics. Okay. So. And then from there, we'll check into telehealth. Okay. I imagine telehealth is going to be far more expensive. But telehealth also could be better for the county as far as liability. Having the availability every day to have inmates. Yeah. Okay. That was one of the very limiting factors with having a doctor that's only in 1 day a week and sometimes available text and calls, but it led to a lot of inmates having to go to the hospital. Okay. For treatment, which was costing us. You can see by our medical bills this year, we were 100% over budget, at least in jail medical. Mm-hmm. And majority of that is hospital visits. Because if the doctor can't actually see them in person, he's going to err on the side of telling you just to take them to the hospital. Okay. Telehealth. So we're going to try and weigh that out. Could we save money potentially with less hospital visits and spend a little more? That's all something we're going to have to discuss when we get some numbers. Okay.
Now, is telehealth, is that part of our, that's not part of our,
No, so there's several companies that specialize in inmate medical, and they do it online through Zoom and stuff.
Okay.
Yeah, any sheriff's conference I've been to, there's always companies handing that stuff out and doing flyers. And so there's several different options depending on the level of service you want, all the way to there's some that even will send a nurse to your place 1 day a week, that kind of stuff. So it's kind of like the more services you want, the more you're going to pay.
That's right.
So we got to figure out what we can get by with and still provide appropriate level of medical care.
Okay. All right. But, do you have any questions?
No.
No, we'll just. This was just to inform you that was happening, and that we got that notice, and that we'll be researching this over the next few weeks.
And will you be putting some sort of advertisement out there or letting the local
Yeah, we'll.
kind of get something out there.
I'm not sure really how to do it without.
Yeah.
Yeah, that's right.
So
Yeah.
we'll have to wade through that, but I don't want to just put an ad out.
Yeah.
Need a
Yeah.
doctor.
Yeah.
You know.
I know.
Yeah. So.
But I mean, just
I know.
getting that kind of out there for our local physicians,
Yeah.
you know, in
Yeah.
Shoshone County.
Yeah, my thought is to just try and reach out to the actual
Yeah.
doctors that have clinics here in the valley,
email
and then
them.
maybe have PAs working under them or whatever
Yeah.
that would maybe
Okay.
interested. And we have one already who's expressed interest, a
Mhm.
doctor,
Oh, good.
but I
Okay.
don't want to say any names yet or anything.
Yeah.
until we
Yeah.
know for
No.
sure. But
Yeah.
Okay.
All right. That was my
All right.
only question.
all right,
Any public questions? No. Okay. Nothing further. We're adjourned.
all right.
Thank you.
Yep.
Appreciate it.